an expert in this field of coronavirus, and Dr. Peter Katona is as a clinical professor of medicine at the David Geffen School of Medicine at UCLA, adjunct professor of public health at the UCLA Fielding School of Public Health, and he joins us on our guest line now. Dr. Katona, thank you so very much for taking time out of your day to join us here. Our listeners and I appreciate you very, very much.
Glad to be here.
Thank you. I had a caller today, a young lady who told us that she has been exposed to people who have tested positive for COVID-19. Her doctor, and she started exhibiting symptoms. Her doctor suggested she go to the doctor, get tested, but she was very reluctant to do so because she has 3 mouths to feed. She has a family. She has a job where she does come in contact with other people, although not necessarily physical contact. And of course, a lot of people were very upset by her position. I think we gently advised her and guided her to do what her doctor told her to do. But before we start taking our listener questions for you, it does occur to me that I'll bet there are a lot of people like her in the country who are so afraid of the economic burden that they're going to face that even if they are potentially exposed or even positive, they're just not going to stop coming in contact with other people. Do you suspect that there's more people like that than we want to admit?
Yes, unfortunately, we have an unprecedented situation here. So yes, there are going to be people of all stripes doing all different kinds of things. I think what's important to stress to your listeners is that we're at the stage now where whatever we do is going to have much greater impact. To do what we're doing a week or 2 from now will have less impact because the number of cases go up. So it's important to do the right thing in terms of what's been recommended social distancing-wise now more than ever.
Correct. And again, I don't want to belabor the point with this lady because I don't want to shame her or anything, but boy, people got so upset saying she's putting people at risk because of the people who are vulnerable. One of the fears I've always had in the last few weeks is that people are walking around, especially younger people, saying, hey, I feel fine. I don't have anything to worry about.
That is a concern. There's asymptomatic carriage of this virus, and anybody could be actually carrying it. So it's foolish to think that just because you don't have symptoms, you're not potentially a carrier.
Okay, let's start taking questions for you. Again, 800-655-6453 for Dr. Peter Katona. He's going to do his best to answer your questions. Let's go quickly to a voicemail.
My concern is that if you catch it and you have no symptoms, are you then passing it on?
That's kind of what we just talked about, being asymptomatic, right?
Yeah, the answer is yes. You can pass it on if you're asymptomatic.
Here is Mike. Mike, you're on with Dr. Peter Katona here on the Mike Gallagher Show. Hi, Mike.
Thank you. Thank you very much for taking my call. It's kind of a 2-part question that I have about this virus. What do we know about the recovery of infected individuals, doctor? Are they being monitored after? Does the virus completely eliminate, or could it hide out in the body and resurface, much like the blastocystic parasite can, where it would test negative but still hide out internally in an individual? Thank you very much.
Good question.
It's hard to answer that question because we don't have enough data to fully answer it. We know that people recover will eventually stop shedding the virus, and usually we're coming to the opinion that it's a little bit after the symptoms have basically gone away. The Chinese have more data on this, but we haven't really measured this in this country yet. We've hardly had enough tests to test the people that need to be tested. So we really can't answer the question based on the population in the United States yet.
Thank you, Mike. Gloria, you're on with Dr. Peter Katona, clinical professor of medicine at the David Geffen School of Medicine at UCLA. Hi, Gloria.
Hi, good morning, Mike.
Hey.
Dr. Katona, I had a question. I'm 72, and there are certain things I have to get at the pharmacy, et cetera. I'm not hoarding or anything, and I'm trying to. Doesn't someone have to literally cough on you? There has to be a transference. If I sort of wipe down everything before I go in, wash my hands when I leave, wipe down the cart before I do any shopping, doesn't that give me some protection? I mean, doesn't someone have to cough or have some kind of fluid, and then you touch your hands, or it goes into your mouth if you're near them?
Yes, the highest risk is if someone coughs on you or within a few feet of you. That is the highest risk. And there is a risk from surfaces and touching surfaces, although we don't know what that risk is. It's going to be a lower risk, depends on the type of surface. We know that on metal surfaces, the virus probably doesn't last more than a couple of hours. So, yes, you have to be careful, but you also have to do the things that are important to you. And we can't basically put people in the same lockdown that the Chinese were able to do a few months ago.
Dr. Peter Katona is with us every day. We want to spend a few minutes with a medical expert who can try to answer some of your questions. Here's a text message, Dr. Katona. How do you pass it on if you are asymptomatic? Assumably, you make the same, you do the same way of transmission. You just don't know you have it, right?
Yes, it might be from touching things that other people touch. There's also a chance it might be just from breathing out, but we don't know the answer to that at this point yet.
Right. Here's Angela. Angela, you're on the Mike Gallagher Show with Dr. Peter Katona. Thanks for joining us. How are you, Angela?
I'm fine, thank you. How are you?
Good, thanks. What's your question for Dr. Katona?
Okay, I'm a non-emergency medical transporter, and I take people to their doctor's appointments. A lot of times I don't know what I'm taking them for, and sometimes I do know that I take people to their treatments for cancer. But I'm in the car all day with them sometimes, so I wondered how I could tell if I've been in contact with anybody and where could I go to get tested.
A lot of parts of that question. If you're dealing with people that are sick and you have any question about it, probably a good idea for those people to put a mask on, the people that are actually ill, and that's if they have some respiratory illness. So I think that's the most important thing. Clearly, anybody who is a first responder or a healthcare worker is going to be at higher risk than the general population. They're in the high risk category, just like the elderly and people with chronic medical conditions. So one, unfortunately, to some degree, has to live with that for our society to keep functioning.
Question on the text line, can beneficial swishing hydrogen peroxide after you've been out in the public, is that beneficial?
I have no idea.
Yeah, there's a lot of questions that are very difficult to answer. You know, Dr. Katona, so many of us have so many questions that we're still learning. What is your sense of the trajectory? Everybody's wondering how long this is going to be our new normal. Any best guess? Weeks, months? Some are fearful that this is going to be a long time.
It's very hard to answer that question with some conviction. There's a lot of factors that enter into this. How well are the social distancing things that we're recommending actually done? You know, the outbreak has a trajectory which is an exponential rise in the curve of the number of cases over time. How much do we affect that by these measures that we're telling people to do? And that's the question. You know, are they going to be helpful in changing that trajectory, flattening that curve, as we've been saying lately, or is it not going to make any difference? And we don't know, but we better try. Otherwise, we're going to have that situation that they have in Italy now.
Yep, we're going to be in big trouble, and they are certainly facing a lot of anguish in Italy, and we don't want to get there. So, hey, best advice, we hear it everywhere, social distancing, try not to come in contact. If you don't have to go to work, don't. Stay home and work from home if you can, and be very safe. Wash your hands at least. I had a doctor yesterday said every hour, wash your hands as much as possible. You can't wash your hands too much right now, right, Dr. Katona?
You cannot wash your hands too much, and it's important to do it for 20 seconds. 20 seconds of washing your hand is an eternity for some people. But
right.
It's got to be 20 seconds. It's got to be all the surfaces of the hands and with some soap. And you can't do that too often, but it's most important to do it when you've had contact with some kind of a foreign surface, because it's that time between where the hands are getting the virus and then touching your face is the important time period.
Absolutely. Thank you, Dr. Peter Katona, for taking time out of your day to join us. You're very helpful, and I appreciate you taking some time to join us here on the Mike Gallagher Show. All the best.